This segment is sponsored by the Springfield Clinic.
For this week's Wellness Wednesday, we have Dr. Stanley Allen here with Springfield Clinic Urgent Care to discuss urgent care access. Dr. Stanley, good morning to you.
Good morning.
Tell me, what are some of the common issues that you're seeing when it comes to urgent care?
Well, now that we're seeing some nice weather, we're starting to see some of the accidents and sports injuries that we normally would see in the springtime. And we're starting to see a little bit of the poison ivy and rashes associated with the change in weather as well.
That's probably because a lot of people are outside, hitting the park and all that good stuff.
Exactly.
Yeah. So is there anything that people can do to prevent themselves from those common health concerns? I mean, I'm sure people don't want to stop going outside.
Right. No, and I definitely, with the nice weather, it's great to be out. You know, the nature of accidents with injuries, it's a little hard to avoid sometimes, but I would always recommend, bike helmet safety, seatbelt use, those things we commonly think of to prevent accidents. And then with regards to seasonal rashes, I always think the first thing you should do if you've been out in weeds or had a potential exposure, you should get home, change your clothes, take a nice quick shower, and make sure you get any irritants off the skin.
How do you know at what point it's time to come and see you, or if you can handle it at home? At what point do you think?
Well, I think once you've tried the over-the-counter things, it's probably time to be seen because there are some prescription medications that can turn things around quickly. And definitely if you're having any respiratory symptoms, fever or worsening conditions, I would recommend getting seen right away.
Okay, and then if our patients, are they able to book an urgent care appointment ahead of time?
They are. We offer that at all 4 of our locations. If you go to the Springfield Clinic site, that will direct you to schedule an appointment at urgent care.
Okay, and if they want to come day of, that's not a problem? I know with COVID, things are changing.
No, I agree. So we've made accommodations at all of our sites to keep respiratory patients isolated from the patients that have other conditions or other issues that they want to be seen for. And we keep those respiratory patients away from them to try to promote general safety.
Okay, good to know. Also, urgent care is moving out of that Wabash building and into a separate new location. Can you tell us a little bit about that?
Yes, we're very excited about the move. We're moving right down the road farther west on Wabash to an area where we'll be in a building with closer access for patients to enter the building, and we'll still maintain having the ability to do lab and x-rays on the patients that are coming to urgent care, and we won't have to compete with other providers in a shared facility.
Okay, what about the space? Do you think it offers more space as well?
It does. It almost doubles the number of rooms we have, and it increases the amount of waiting room space that we have for patients. They're not going to have to compete with other providers when they're in the waiting room or when they're utilizing lab or x-ray.
All right, perfect. Sounds good. Dr. Stanley, thank you so much.
Thank you. Take care.
Yes, you too.